You're discharging from the hospital. So now what do we do to make sure you don't go back to the hospital? In healthcare, there's a nasty word, readmission, that there are financial penalties to the hospital if you don't stay out at least 30 days after your discharge date. So this is, again, educational. I want you to use it to create great questions, to have the strongest conversations with your care team. And so this has very high level reasons you could admit to the hospital and breaks it down. So we've got congestive heart failure is the first. Each has the same format as to what kind of information it goes over. So a little bit of information, 25% of patients with congestive heart failure do readmit. Unfortunately, that's by CMS data. And then what we do have on our first expansion, so each of these has an expansion. Self-check, am I on track? Are you doing daily weight gains? Are you taking your water pills? These are interactive as well, so you can click yes, great, or you can click no, and it'll tell you what the risk is for that. Same thing here. Are you taking your water pills or diuretics? Yes, no, what's the potential outcome? But these are guidelines. Great way to create those conversations for your care team. And then on the bottom, it tracks how well you're doing and that you need to bring the questions that you answered no to your next doctor's appointment. Next section is to call your doctor immediately if you have any of these red flags, but I want you to understand that this is also, you know your body. You know your body best. So if you're having any of these, take them into mind when you're making decisions, but this really comes down to having good questions, making sure you're having thorough conversations with your care team. And then our next expansion is your prevention checklist. Again, follow your prescriber's instructions. That is primary. Again, this is just from an education perspective. And then, because I'll die on the hill, the great questions give great self-advocacy, just some more questions that you can ask for your care team. Each one of these is the exact same structure. So our COPD, these each expand with different questions on what they are, red flags, your prevention list, questions for your care team specific to your COPD. Same thing with pneumonia, diabetes management, sepsis recovery, urinary tract infection, joint replacement recovery, heart attack recovery, and renal failure and hemodialysis.